Welcome to Messy Mondays, where healthcare admin gets real one mess at a time. I'm Brittany,
And I'm Satasha.
and we are BCN. And today's topic for our Messy Monday is clinical documentation and coding and the revenue cycle connection with those two things. So, as most of you all know, clinical documentation, coding, that goes hand in hand with billing. The provider's record of the patient encounter, like their symptoms, their history, exam, treatment plan, that sort of thing, all should be in your clinical documentation.
Yeah, it's basically running into what we just talked about earlier. So the patient comes in, schedules the appointment, you run eligibility, you do copay code insurance. Like we said, if it's a test, if it's an image, or you busting skin, you're making sure that you're getting your authorizations. Um, and then patient is seeing the clinician. So whether you are a doctor, whether you are a nurse, whether you are a therapist, it doesn't matter. Your notes need to be complete and thorough. And we hear complaints a lot about, oh, it's too much, too many words, too many. If it's not documented, it didn't happen. And if it didn't happen in the documentations, you cannot bill for it. And so that's how people lose money or have money retro taken back from them because it wasn't listed in your documentations. So you must make sure that your clinical documentation is tight. It's real tight. So if you've seen a patient for XYZ, those are the diagnosis codes that you need to be using. I know there are some variances depending on your specialty, because if you are a chiropractor, for instance, you shouldn't be using any behavioral health codes, if that makes sense. So there are scenarios where there are specialty related codes, but you going into business or you working for a practice, you need to be talking to your biller or whoever your trainer is to know exactly what codes am I permitted to use. And that's what your documentation needs to reflect. If you are doing labs, it needs to say that in your clinical documentation. If you are running any type of test, if a big thing for imaging, it needs to be medically necessary. So if you are going to take a CT scan of somebody's head, you can't say the patient came in with shoulder pain. They're not going to pay it because it's not medically necessary. You're not saying that the patient is having an issue with headaches, or the patient hit their head on the side of the wall when they was doing jumping jacks and they tripped over, things of that nature. So it has to make sense in your medical documentation as to why you're doing the services that you're doing. So just make sure there's a cause and effect when you're writing your notes. I did this because the patient was exhibiting these type of symptoms, or the patient came in for this, so this is why I had to do this to make sure these things aren't going on, or this is how I was going to treat the patient. So make sure when you're writing notes, cause and effect. Cause and effect. The cause is why the patient came to see you in the first place. Effect is what you did in order to treat the patient or to find out what's going on with the patient. Just make sure that your notes are tight. They need to be tight. They need to be locked in, because,
Yes.
as Brittany said, notes ain't there, billing can't be done.
Yeah. And if the documentation is incomplete or vague, like Satasha said, the coding becomes guesswork. And payers will not reimburse for what isn't clearly supported. So please make sure that you are documenting appropriately. Um, and this is what drives your revenue. So that's why it's so important. Clear documentation that ensures that your biller, your coders, whoever, can assign the highest appropriate code for your maximum reimbursement. Um, and claims can be denied when the documentation doesn't support the code bill. So document, and be clear, and make sure you're putting what needs to be put in your notes. So
Absolutely. And to emphasize on the part where she says the highest reimbursable services that you have rendered, did you hear what she said? The documented reimbursement. Documented. So don't have your biller trying to upcharge. Don't be billing the 299205, 99215s. Don't the 90837s, and you only seen the patient for 15 minutes. Um, Everything is based off, criticalness, what happened. Every single code has a definition. Every single code has a definition. You need to read up on that. You need to make sure that your biller or your coder, whoever is in your revenue cycle department, is keeping you clear. This is a 30-minute service. So if your document is not, if you're not documenting that you took 30 minutes with the patient when it comes to them coming in, you seeing them, and then you writing up your reports, if that's not 30 minutes, then you're upcharging. And upcharging can lose you money. Upcharging can have you, and this is what y'all be scared of, bum, 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 audits. Upcharging causes audits. Miscoding causes audits. So if you are doing things or charging for things that you're not actually doing, the insurance company is going to be like, fine, it's not just this code. We're going to run it back to see everything that you did, and we're going to take everything back from you that you have billed. And that causes you to lose money. And that doesn't just cause you to lose money in the sector of the insurance companies are not reimbursing you. You also can be fined by OIG. Sam can come in, you can lose your license. It's a lot of things that can happen if you're not billing and charging correctly for codes. So let's just meet, like she said, you need to be locked in, notes need to be there, and you only need to be billing for services that you are rendering. Just be careful, because you don't want to lose money or your practice or your license because you lying to the insurance companies.
That is correct. It's just best practice. We tell our providers that our clients that we work with, we will not bill without documentation. So, I can't speak for other billers and other companies, but BCN does not. Like, we will, hey, you got 40 notes missing. You gotta get them done. We will not bill if the note is not there, because like Satasha said, and like I said before, if it's not documented, it never happened. And you don't know when an insurance company will come back and audit you or whatever the case. And then, you don't have the documentation to support the billed visit. So do your documentation, guys.
Yeah. Don't be a liability to yourself or your patients, because
Mm-hmm. Yeah.
that it's not fair to them for them to have a trusted provider and they're not doing the right things. There's plenty of doctors that have been to jail because they weren't doing the right thing. They weren't acting appropriately within their practice. So just make sure that documentation is done so your billers can do the appropriate thing. And if we notice something, I can't speak for other billers, BCN, if we notice something is wrong in your notes, we'll reach out to you and let you know. So if we see that you're billing something and it's only once per year, that code is only allowed once per year, and we see that you're billing it over and over and over for this patient, hey, we're going to stop your billing and say, hey, let's talk about this. What are you doing? What are you doing? So we do review notes and stuff like that to make sure that you are billing appropriately, that you're coding your stuff appropriately. And I know it seems like a lot, but to know your codes and what you can bill for it, that's up to you. And it's up to us to make sure that it's verified within your notes and that it's billable. And if you are missing something, we'll say, hey, did you XYZ? And they were like, yeah, well, we're going to add this charge we need to add this charge to the claim. And we also make sure that your modifiers are up there. Modifiers are very important, especially when it comes to billing. So it's good it's essential that you know face-to-face visit, or this was a virtual visit, so we can know which modifiers to use when it comes to billing. Then there are other modifiers, especially when you're grouping codes together. So making sure that you document helps your billing on the back end.
The key takeaway from today's Messy Monday: strong documentation equals accurate coding, which equals clean claims, which equals faster payments and reduced compliance risks. So no audits, penalties, things of that sort. So please just make sure you're doing what you're supposed to. And it's best practice, guys, really. So
That wraps up another Messy Monday. We tackled some tough truths, and remember, it's all about improving, learning, and becoming a better provider. Learning what's best for your practice and your patients. If you found this episode helpful, share it with your teammates and keep this discussion going. You can click the links below and go through all our social medias, and we're there to help you guys out. Join us next Monday for more insights to help your practice game tighten up. Until then, keep it cute, stay ethical, and take care of your patients. Bye.
I